and today I'll be demonstrating how to insert a Foley catheter on a female patient. For this video, we'll be using the sterile Foley kit and focusing on sterile technique as well as applying the Foley catheter in the patient. The first thing that I will do is perform hand hygiene. And the next thing that I will do is open up my Foley kit. I want to make a slight note that I have been using this often, so when I do take it out of the packaging, the fold does come out at times. And I can dispose of the packaging that comes in the trash. And now I will open up the Foley catheter kit with the outest fold first, and then the side folds, and the fold most closest towards me. Once that has been completed, I will begin to don on my sterile gloves. I will carefully place this on the table and open it with the 1-inch border. Again, only use the 1-inch border. We do not want to break sterility, otherwise we'll have to repeat. So I'll don on my right hand first. I'll obtain the glove by scooping it by the cuff. Next, I will don on my other hand, and I will scoop with using my fingers by the cuff. Once my sterile gloves have been applied, I will need to ensure that I keep my hands above my waist. If I do go below the waist, I'm breaking sterility. I will dispose of my sterile glove packaging in the trash. Once that has been completed, I will now apply the drape on my patient. The patient will need to assist me by using their hips. I cannot touch the patient just yet. And the shiny side will be facing down. Once the drape has been applied, I will now apply my fenestrated dressing. I want to make a little note that if there is a tear from prior use, in real world setting, there would be no tear. Once the fenestrated dressing has been applied, I will now begin to assemble my Foley kit. I have my alcohol swabs, which will be used for cleansing the patient, which I will keep right beside here. And first thing, I will open up the lube and place that here. I will dispose of this in the trash. Next thing I will do is set up my syringe that will be used to fill up the balloon. And this will go in the Foley kit. Once the syringe has been placed, I will keep it easy use, and I will take out the tubing from the sleeve and prep it to get it lubed. I can dispose of this in our trash. And I will carefully place the tubing in the lube and just have it prepped, have it ready for insertion. Alright, now that our Foley catheter is prepped for insertion, we will again clean the client one more time with the 3 swabs provided. The first thing that I will do is position using my hand, and once I touch the patient, this will be considered not sterile, so I can only do things with my dominant hand. For the first swab, will go on the outer labia fold, and we'll go from top to bottom, and then we'll dispose of it in the trash. The second cotton swab will go from the labial fold closest towards me, and again we'll go from top to bottom, and this will go in the trash. And lastly, the last swab will go from the middle down, and we'll dispose of it. Next thing I will do is insert the Foley catheter. I'll pick it up from the lube and we'll need to insert 3 to 4 inches in. Once we see urine, then we can advance another 1 to 2 inches. After that has been completed, we will begin to inflate the balloon. Once all the fluid has inflated the balloon, we'll take out the syringe and we can dispose of this in the trash. And then we can begin to place the Foley catheter. We will need to have the tubing placed below the bifurcation and have the bag placed below the bladder. We can have it by the mattress. And once we see that the bag is getting filled, we need to note for urine color, if there's any blood present, cloudiness, just appearance. And once all that has been completed, we can now clean up the patient and our surroundings. Throw this away, and then we can clean up our workspace. And I can take off my gloves. I'll perform hand hygiene one more time, and I'll have my patient covered. I'll make sure that the bed is at lowest position and that the call light is in reach. I will ask the patient if they are feeling comfortable and if they have any questions or concerns for me. They say that they're fine and there's no questions or concerns. I will then ensure that the safety is present within the room, and I will close the door and instill patient privacy. I will then document the procedure form and any new findings found from the urine observation. Thank you so much.